Firefighters are required to engage in activities that are physically strenuous, including climbing stairs while wearing heavy protective clothing and equipment. The Stairmill test is designed to test your cardiopulmonary health and fitness to ensure you can safely do the job of a firefighter. All candidates must take the Stairmill test. Do not assume that you will be able to pass the Stairmill test because you passed the CPAT. The Stairmill test is longer than the Stairmill event during the CPAT. This video will demonstrate the Stairmill test. Feel free to stop this video at any time to play back any section that you may think is helpful. Before your medical exam, you should practice for the Stairmill test. If possible, you should practice for the test on a Stairmill machine while wearing a 50-pound weighted vest. Your local gym may have a Stairmill machine and a weighted vest. You can also purchase a 50-pound weighted vest from a sports store or online. Please note that the machine you use for the Stairmill test will be like the one shown in this video. It will not be a stepper or other stair climber machine usually found in gyms. On a Stairmill machine, you will have to pick up your foot completely and climb to the next step. If you do not have access to a gym with a Stairmill, you can practice by climbing stairs in the stairwell of a building without a vest or while you wear a 50-pound vest. Climb the Stairmill or stairwell at the rate of 1 step per second. Do not touch the handrails of the Stairmill or the walls or railings of the stairwell as you climb. To prepare for the Stairmill test, as well as the rest of your medical exam, you should follow a physical training program that combines aerobic activity with strength building. On the day of your test, do not exercise heavily for at least 2 hours before your test. Do not wear tight clothing that makes it difficult for you to move or breathe. Please wear comfortable, modest gym attire. Do not eat a large meal within 2 hours before your test. On the day of your medical exam, FDNY personnel will instruct you about how to take the Stairmill test. Information on the test may also be found in FAQ Part 7, Cardiopulmonary Fitness Station, and the Firefighter Candidate Medical Examination Guidance. You may be allowed to take the Stairmill test up to 3 times on different dates. The same procedure is used during all 3 attempts. The only difference is the type of follow-up testing that may be necessary if you fail an attempt. Even if you fail the Stairmill test on all 3 attempts, you may still be able to become a firefighter if you provide satisfactory results from the 3 follow-up tests described later in this video. The test lasts 5 minutes. You will wear a 50-pound weighted vest for the entire 5 minutes. For the first minute, you will climb at a rate of 50 steps per minute to warm up. For the next 4 minutes, you will climb at a rate of 58 steps per minute. The 5-minute period is continuous. There will be no break. FDNY medical personnel, a physician, a nurse practitioner, a physician assistant, or a registered nurse will observe the test. During the test, please keep the following instructions in mind. Ask any questions you have before the test begins. FDNY personnel are not permitted to talk to you or otherwise distract you during the test. Climb 1 step at a time. Do not bounce or bump into any part of the Stairmill. Once the test has begun, you may not touch any part of the Stairmill with your hands, arms, or any other body part. If you touch the Stairmill, even just to get your balance, the test will end and be considered a failed attempt. You cannot listen to music, wear headphones, or wear a joint brace or support. The Stairmill machine will display the amount of time that elapses during the test. If FDNY personnel determine you cannot begin or complete any of the 3 attempts, your candidate discharge report will require you to address certain conditions before you can be scheduled to take the Stairmill test again. Examples of conditions that may be identified in the candidate discharge report are post-test abnormal blood pressure, post-test irregular heartbeat, or post-test abnormal breathing, such as wheezing, shortness of breath, or difficulty breathing. If you do not successfully complete the second attempt, the FDNY may offer to schedule you for certain types of diagnostic testing. You will have the option of being scheduled for the diagnostic tests conducted by a third-party provider at no cost to you or having the medical testing done by a provider of your choice at your own expense. One diagnostic test is an echocardiogram, which looks for underlying structural or mechanical heart problems. This test uses ultrasound to look at things like the size of your heart and the motion of the walls of the heart. The other diagnostic test is the METHACHOLINE challenge, which tests for asthma or disease to your airways or to the lungs. During the test, your breathing capacity is measured after each time you inhale sequential doses of methacholine, which is an irritant. The test continues until either the maximum dose of methacholine is reached or your breathing has decreased too low. At the end of the test, you may be required to inhale a bronchodilator, which is a substance that dilates the airways to the lungs to determine if your breathing improves. Both of these diagnostic tests are designed to detect if you have an underlying medical condition that may cause you to be unable to exercise at a moderate to high level or complete the Stairmill test. An FDNY physician will review the test results and decide if you will be allowed to attempt to take the Stairmill test a third time. If you do not pass the Stairmill test on the third time, you can take an exercise treadmill stress test scheduled by the FDNY with a third-party provider at no cost to you. This test helps determine how well your heart responds to exertion. If you choose to take this test, you will walk and/or run on a treadmill. The technician will gradually increase the speed and elevation of the treadmill to determine if you can safely exercise at a moderate to high level. You will wear external electrodes that measure your heart rate, blood pressure, and heart rhythm pattern. The technician will stop the test early if any of these become abnormal or if you appear to be in undue distress. If at any point an FDNY physician decides you are not medically able to attempt the Stairmill test again, or you fail all 3 attempts and do not provide results showing you passed an exercise treadmill stress test, you will be sent a notice of proposed disqualification. That states the FDNY is proposing to find you not qualified for appointment as a firefighter. If you receive a notice of proposed disqualification, you will need to follow the instructions on the notice. Here are a few reminders. Ask any questions you may have before the Stairmill test begins. FDNY staff will not be able to answer any questions during the test. Wear comfortable, modest gym attire to your scheduled appointment. The Stairmill test requires that you be physically fit. Prepare by doing aerobic and strength building exercises. Passing the CPAT does not guarantee you will pass the Stairmill test. Practice for the test by using a Stairmaster or real stairs and by wearing a 50-pound vest if you have access to one. Climb one step at a time. Once the Stairmill test has begun, you may not touch any part of the Stairmill with your hands, arms, or any other body part. Avoid bouncing or bumping against any part of the Stairmill. You cannot listen to music, wear headphones, or wear a joint brace or support. The Stairmill machine will display the amount of time that elapses during the test. FDNY medical personnel will oversee the Stairmill test to observe you for signs of dizziness or physical distress. If it is determined that it is safe for you to do so, you will have up to 3 opportunities to pass the Stairmill test, but only 1 attempt per visit. As mentioned earlier, for more information, please review the Firefighter Medical Candidate Examination Guidance and the Medical Examination Frequently Asked Questions. You may access these documents by clicking the link for candidate resources on joinfdny.com or by logging into the FDNY's candidate portal. Good luck.